What are the implications of low awareness, especially I think for patients who already might have heart failure, but also for patients who are at high risk?
Low awareness is very far reaching, and it occurs at every single level. It occurs with the patient, it occurs with the public and the community, it occurs with healthcare professionals, it occurs with policymakers, and at each one of those levels, there are obviously repercussions. And so there's also an important component of misinformation. Misinformation is very dangerous. I mean, if you think that you've got a condition that is irreversible, then your approach to getting care is very different. So misinformation is very dangerous, and it disempowers individuals to actually be able to seek the right kind of care. I think that educating patients about danger signs and how to take the medication and what to take has real value. You know, we often dumb things down for patients because we feel that they don't really understand, but actually if you explain it to them really well. Problem is we don't have time. So we do need, it can't just be the responsibility of the healthcare professionals seeing that those patients at the time. It does need to be a multifaceted approach where, you have education in the waiting room or you have education in communities. Also, what I found interesting was that although people who knew someone with heart failure had some kind of understanding of it, it wasn't as many as you think. And just the mere fact that that quite a lot of people in your gap report knew somebody with heart failure was quite it is quite important. Like if you know someone, it's quite frequent. So I think that the first thing is to recognize that there is low awareness, but you also have to know what the awareness is and where the problems are. Do we understand the definitions of heart failure? Do we understand the symptoms? Do we understand the impact on mortality? And what is the result of that low awareness in that particular context? Because I think each context is slightly different. And then also understanding that low awareness actually has cost implications. If you don't have awareness that this is actually hospitalizations due to heart failure is a very expensive component of the healthcare system, then and to patients who are paying out of pocket, then it really can be quite detrimental to those patients if they're constantly in hospital. So I think the implications are far-reaching, and the idea of changing awareness is actually to empower people to be more in control.